Kristen, I'm sorry. Let's continue doing what we have to do, which is calling them, asking for more input.
Can I ask a question about that? So I can just wait until we get the report back if it's more appropriate, but the kind of feedback that we received, was it about more particular individual support for small businesses? Or were there any sort of large scale, maybe outside of the box investments that folks recommended?
No, the feedback that we got was more about technical assistance, support in marketing, for example. That was one of the child care representatives. She proposed more support in that area. We expect for the next meeting with the Hospitality Association of bigger groups to have more general recommendations. And in this case, we received like a specific point. So, I don't know if it's wrong.
I think a lot of challenges around hiring, around really adapting to this business and trying to stay above water. It was really, I think, very enlightening around where a lot of those issues are at relative to sometimes where we think they are and the level of support that they would like to really educate the level, whether it's hiring, technical procedure,
and Mr. Mayor, it was in the expectation that we have. Every business owner, a small business owner, they just see the closed circle around. So they are looking at how they suffer during the pandemic and look at their solution for their group. For example, child care with the common suffering that they had. And we had present a hair salon owner, so always around their circle. So it was in the expectation, in the range of recommendation that we were expecting.
To add to that, there was also a call to invest in Black owned businesses and also to invest in mentors and provide mentors with their ideas Black owned their own personal resources. So pretty important that there was a call for running Black radio shows as well.
May I ask a question? When you're doing these public forums, have you done any that aren't on nights or weekends? Because I know that's really hard if you're employed in certain industries, like hospitality, restaurants. That's their busiest time of day and week. We're going to push the 21st. We're going to do an e-blast and some social media on it for membership. Yep.
Thank you. So we'll move on to item number 3 on the agenda. We're expected to have 2 presentations. The first one is from Lori Sears-Moise. And it's on health equity and resiliency. And Laurie's going to be joining us virtually. Good afternoon, Laurie.
Hello, good afternoon. Thank you for having us today. I'm joined, my colleague, Rachel Newman-Green, is also on the call. We'll be presenting on health equity and resiliency, what that looks like for the city of Providence during COVID times, and also how we can address food insecurity. If I may, I would like to share my screen if that's possible. I'm getting a pop-up here that I am not allowed to share my screen. All right.
You should be
Thank
okay
you.
now, Lori.
Thank you. Can everyone see the screen?
You can.
Perfect, thank you. Again, good afternoon. Thank you for having us. My name is Lori Moye-Sears. I'm the director of the Healthy Communities Office, and my colleague Rachel Newman-Green is here as our deputy director. And we're excited to discuss what health equity looks like and how we can create a resiliency plan for the city of Providence. For those who need a refresher, the Healthy Communities Office is the city's lead agency for health policy, health promotion, and substance use prevention. The HCO works to ensure that Providence residents have equitable access to resources they need to live a healthy life. Historically, our three main areas of focus have been behavioral health and substance use, child and maternal health, including PPSD involvement in mental health and food security. Now, we know that these three areas of focus is not the only thing that makes someone healthy. We recognize that health needs of Providence residents expands beyond these three categories. And we also saw, as a result of COVID, how underlying health disparities in communities of color impact residents in the worst way. And we see that our folks of color have been impacted the most throughout this virus due to the health inequities. So what does the city of Providence look like now? COVID-19, as I mentioned, magnified existing inequities in social determinants of health, including neighborhood and environment. What do our urban neighborhoods look like? Were folks able to isolate? Were folks able to socially distance appropriately? We're looking at economic stability, access to virtual education. What did that look like for our folks, and access to appropriate health care? We are actively seeking for funding to ensure that this does not happen again in the next disaster. I'd like to walk through some trends that we're seeing across the nation at this time, knowing that COVID-19 data is currently still being collected by national organizations at this time. When we're looking at housing and social determinants of health, we see that lead exposure rose in the time of COVID-19. Particularly in Rhode Island, we saw that this is the first time lead poisoning increased this last year. 4 cities accounted for 69% of the reported elevated lead levels, including Central Falls, Pawtucket, Providence, and Woonsocket. We can infer that's because, folks were bound to being at home. They weren't able to leave due to isolation. Other housing needs, as we know, the eviction moratorium is no longer protecting our residents, and encampment spaces have also been developed throughout this time due to housing shortage and other social service needs. When we're looking at physical activity, the demand for green space is necessary. As I mentioned earlier, folks that are in urban environments weren't able to isolate appropriately and or social distance. So the need for urban green spaces has extremely increased during this time. And having the ability to address this now will prevent issues like this in the future. As I mentioned earlier, the Healthy Communities Office, we do have work going on right now on mental health and substance use. But I wanted to highlight the increase of accidental drug overdose deaths. We're up about 25% from 2019 to 2020. When we look at our comparison to the state, we see that 104 happened in Providence for the year of 2020. And now we are in August, or rather September of 2021, and we've seen already 214 accidental drug overdose deaths. Nationally, the Kaiser Family Foundation reported that there was an increase of parents reporting mental health concerns in their households and access to care being an issue. We can infer that this number has increased during this time as folks are bound to home, and as schools are opening up, folks are going back to work. We know the stress that can go along with that. When looking at reproductive health, Frontiers in Global Health found that in a recent study completed in February, that women were responding negative impact on their pregnant and postpartum experience during COVID. This could be due to cancellations of appointments, suspensions of services, and isolation during delivery. It is unknown the long-term effects this may have on maternal and child health, but we can also assume that we will see some side effects of this due to COVID-19. Education access. This is huge. We are back to school. We are dealing with folks being afraid, scared, nervous, uncertain of what the year will look like. And the American Psych Association reported that although there are some benefits to remote learning, many students will experience an academic and social decline. This is huge for our kids, as we don't know what it will look like in the years to come. We believe that we should address this social and emotional and academic decline now, rather than waiting later. I know I just shared a lot of stats. I do want to go back to the existing programs that the HCO currently has on the ground. We have on the behavioral health side, we have our Mayor's Coalition on Behavioral Health still standing. We have work in the downtown area to combat overdose. Partnership for Success, which is a grant that we're working on through SAMHSA that addresses tobacco and alcohol use. And of course, we are planning on launching a behavioral health crisis response soon post our planning period. We have some reproductive health efforts. We are working with the Providence School Department to ensure that menstrual hygiene products are available for students free of charge. We have some doula support and also food insecurity efforts that we will later discuss in this presentation. We also have some involvement in mental wellness in schools. Now, this may seem like a lot, but we know that it's not enough, right? We need data, more data post-COVID and communicating with our community. Reason being, not knowing where our community stands right now is a deterrence to the work that we can provide to them. Which leads me to our biggest challenge. We don't have a clear picture of what's going on in the community right now. And this lack of clear picture and strategy to increase resiliency and equity, emergent health needs of Providence population. Armed with local health data, we'll be able to build out programming to address the immediate needs, but also combating disparities at our point right now versus waiting until the next disaster. So what do our priorities look like? When we think about what developing and implementing a citywide health equity and resilience plan looks like, we need to speak to the people first, right? Our first step is looking at what data is out there, what data is needed, and assess where we are during these times. We want to focus on social determinants of health rather than clinical needs. As we see during COVID-19, social services was needed, food was needed, education access was needed, and that is more on the social determinant side of things rather than clinical. And our next priority is developing a plan. What does that look like? And in order to do that, we would need to build capacity for the city to respond appropriately in target areas that the city can impact, and looking at identifying funding for opportunities to increase staff capacity and this response effort. I think it's important to note that many of the programs that the Healthy Communities Office is currently engaging in is due to what's out there, what funding is available, what we're able to assist with. And speaking to the community and looking at our, the needs of the city of Providence and the folks that, that we serve is very important. Knowing what step to take next and how we can mitigate any disparities in the future. I just shared a lot. I did want to open up some space for questions at this time before we move on to food access. Does anyone have any questions so far?
I have a question. Could you please go back to the reproductive health slide?
Sure.
Okay. It says that the study completed in February 2021 identified a negative impact on the pregnant and postpartum experience. That is just as a consequence of the COVID-19, or there is a pattern in the last 3 or 4 or 5 years?
And is the question relating to this slide if it's directly correlated with COVID-19? I couldn't hear the question clearly. Yes, it is. Yes, these questions were asked of individuals who were pregnant and gave birth during COVID-19 and isolation period, yes.
And that impact, do you have data regarding how was the impact in BIPOC communities against other communities? Has been bigger, the same, is it standard?
That's a good question. I can get back to you on the specific data on that, but I will say historically, folks of color have had a extremely difficult time during their maternal stages of being pregnant and also delivery. So we can assume that BIPOC individuals suffered tremendously during this time, given the existing stressors that they already had prior to COVID-19. I don't want to make assumptions with numbers, but I can definitely take a look to see what the differences are.
Okay, thank you.
Larry?
Thank you for the presentation, and I have a question / suggestion depending on the answer. I was wondering if you had connected with Blue Cross Blue Shield on their index. Helpful information about social determinants of health, maybe with the need to do a health needs assessment in the city, maybe they can do some oversampling in Providence if that hasn't already been considered.
Did you hear that, Lori?
No, I did not. I'm sorry. Angie, I can hear you.
I know, I'm staying on top of the microphone, that's why. Larry said, have you connected with Blue Cross Blue Shield on their Rhode Island Life Index that they've been doing? I think this might be the 3rd year, Larry? Because they do some sampling across the state on social determinants of health, and perhaps there's an opportunity to do some oversampling in Providence for the assessment that you mentioned in your slide, correct?
Thank you. We are aware that there are, hospital associations, Blue Cross Blue Shield, and local health equity zones doing this work. And we are interested and definitely looking forward to connecting with folks. The main concern is capacity. Do we have enough folks on the ground that could help put this information together for the city of Providence? So yes, we are aware that other orgs are taking part in this, but we're looking for increased capacity for that nature. Yeah. Does that answer your question? I'm sorry, the sound isn't the best on my end.
He said, yes, that's fine. I want to piggyback on Larry's question. I noticed that maternal child health is part of under the scope of the work for the Healthy Communities Office. And I also vaguely recall the Children's Youth Cabinet. And the work from the Children's Youth Cabinet in Providence did a door-to-door survey in Providence on children and their families. And there were some next steps and initiatives that were implemented as a result of that. So my question is, how is this work connected to the Children's Youth Cabinet, if it still exists? I haven't heard much about it since then. And 2, is there opportunity to utilize the same survey and sampling method that they use in the Children's Youth Cabinet to sort of get another point in time? Because there was overwhelming amount of research about children's health and their families' health, particularly in the neighborhoods in Providence, and whether or not this offers the opportunity to take a look at it post-COVID, and to look at what's needed moving forward.
Lori, do you want me to speak to that a little bit?
Oh, yeah, sure.
So Angie, that is a good question. I don't know what the latest is on the work that the Children and Youth Cabinet did, but I guess I will echo what Lori said, that our biggest challenge really is that the capacity of our office is really limited. And so the ways that we've been interacting with the maternal and child health at this point, or reproductive health in general, is around supporting the doula initiative and is around the menstrual hygiene products in the schools. And those are important but small pockets. And so I think what we're really looking to do in developing this plan is figure out where the other pockets are that we need to be activating and be more active in, because there's certainly plenty of opportunity and need for, I think, the city to be more engaged in that. And I think part of the charge will be to figure out how the city can be productively engaged, because there's definitely things that are beyond the city's scope. And so really using the planning process that Lori is referring to figure out really how we can be most effective and what data we need to be most effective and what we need to activate to really, positively impact health of women and children in our community better.
Mayor Larza and Julian.
Go ahead, Julian. Go ahead.
Thank you, Lori, for the presentation. I don't know if you could hear me or if you have to repeat it. Thank you so much, Lori. This is Julian. Couple of questions with it. One is, for the priorities you mentioned with the needs assessment and developing the equity and resiliency plan, are those things that you currently have funding and support capacity to do, or are those requests for this group to consider? And if so, do you have any scope in terms of how much funding will be needed to do that? The second question part of that is, given how similar some of the impacts and issues have been across Pawtucket and Central Falls as well with our hard-hit communities in Providence, if there's any discussion around collaborating with those municipalities on doing some similar work together to look at those comparisons. And then the third one is a kind of bigger open-ended question, but in many other states, there are local health departments with cities that can do a lot of this work. And in Rhode Island, as you know, we only have one statewide health department, which does a lot to support what we can at the local level. But just wondering if that's something that is kind of under consideration or being questioned at that local level about creating a city or regional health department that can really address that there are really significantly different needs in that kind of Providence as well as Pawtucket and Central Falls urban core compared to the rest of the state, and how to really address the gaps there and build out the supports that are needed at the local level.
Thank you, Julian. I'll start with the capacity question. We do not have funding to address these particular needs. Most of the work that we are currently charged with are grant funds. And as you know, grant funds can be very limited at times. So the hope is that we can put some funding through this our task force to address the needs of social determinants as a whole. I hope that answers your first question. Secondly, if there's a discussion about having, was it local organizations working with other cities? I'm sorry, it broke out a little bit.
Yeah, it was if the work around doing this assessment and developing a plan, if it's connected at all with conversations with Pawtucket and Central Falls at the municipal level, I was thinking, but as well as at the community level.
We haven't started those discussions yet, but preliminarily, Rachel and I had discussed food access and the similarities across different food deserts in various cities. Rachel, did you want to speak to that, the conversation we had with Jazz?
Yeah, we were talking about kind of exactly that, Julian, looking at urban core cities and how we can look at the shared concerns that we have with our other urban centers and bring those forward to the state as specific urban concerns, because a lot of times those do get a little bit lost in the wash when we're talking about food systems issues and that sort of thing. I think from my perspective, so on the one hand, there's definitely sort of strength in unifying with other communities that we have things in common with. A lot of of my concern is also because we are working within City of Providence government and things that, you know, a lot of my concern is really about how do we make things work within City of Providence government to address these issues. And so that's a little bit different than how you do that within Central Falls government or within Pawtucket government or whatever. So there are definitely commonalities and there are specific things that we need to figure out right here within Providence.
Thank you.
We can keep going, that's fine.
Thank you, Lori and Rachel. We're gonna move on to the next presentation, which I believe Rachel is doing on food insecurity.
Yes, thank you.
Security.
Yeah, so our focus on this really was around the concept of resiliency and wanting to look at where we're at now and how we get to a better long-term space. So Lori's going to be my my clicker. So Lori, if you move forward to the next slide, please. There we go. So just to give everybody a picture of where we were during the real height of the pandemic crisis at the very beginning, in March of 2020, our office very quickly pivoted to emergency food distribution, which we did via a lot of different methods. In total, between March and June in 2020, there was 1.4 million plus emergency meals that were distributed through our office and other partners. The bulk of those were distributed through the Parks Department and Providence School Department at recreation centers and at schools. So almost 1.3 million of those were through that work. But there were many other funding sources and many other sources of meals that went out during that time period. There was a big focus on making sure that elders had access to meals. So Meals on Wheels had additional funding and partnered with them on logistics just to distribute 33,500 meals to elders in the community. Brown Dining Services, SNAP Chef, and URI all face the same challenge where they had enormous capacity to feed folks, enormous capacity to feed, to serve meals, and no people to serve the meals to. So they had employees and trainees and everybody else set up to cook, and nobody coming through the door. So via Brown, URI, and SNAP Chef, we worked very closely to help distribute prepared meals and kitchen goods and everything else that came through them out into the community. In addition, we helped activate the first ever kosher meals service. So these are free meals for children who required kosher meals, and we're able to work with the Jewish community on providing over 19,000 of those meals to food insecure children in their community. And then there was an additional 1,200 meals that were donated through Fidelity Investments that we also helped distribute. So it was a real crush over many months, and we had some members of our very small staff really out there every single day, making sure that all these meals were getting out into the community. Lori, go to the next slide. So despite the work that we were doing to do all this and everything that was going on a federal level policy-wise and everything that was happening throughout the country to try and meet this real immediate food need crush, overall disparities increased and continued to increase throughout this time. So there was a study that was done, this was just in July 2020, so still looking at that same couple of month period, that showed that at that point, 47% of Latino households in the country were reporting food insecurity. Next one, Lori, please. So that really was in contrast to data that shows that that just came out actually this past week, that shows that nationwide, on average, food insecurity was unchanged between 2019 and 2020. And what that really shows is that the inequity increased. So nationwide it was unchanged, but folks that became increasingly food insecure were households with children, households with Black primary householders, households of Hispanic primary householders. And during that period, also the gap between Black and white households in food insecurity grew. In 2019, it was 11.2% gap, percentage point gap, and it grew to 14.6 point gap. So what that really demonstrates is that, you know, in the very big picture as a country, we are not more food insecure because of the pandemic, but that insecurity is really concentrated and increasingly concentrated in our communities of color and other communities that face inequities. Next one, Lori. So what we are doing currently in our department around food in general is the emergency food distribution plan that I just described, which we enacted at the height of the crisis. That plan really was like I have here, a building the bridge while we were crossing it. We were taking calls every day from people who needed food, but also very many people who had things to donate. Our ability to distribute and get that food out into the community was really based on the existing networks and relationships our office already had. So we have many partners throughout the community, largely a partnership, a list of religious organization leaders and other folks that we've worked with on our substance abuse prevention and other work, that we already had a phone list and an email list. And those are the folks that we had to call on when we had all of these meals to distribute. So if we didn't already know someone in the height of a crisis, it was very unlikely that we would be able to find someone to help get these meals out. Like I described, we had this flood of resources all of a sudden. There was a flood of philanthropy. There was a flood of food coming from institutions that came all at once and then swiftly dried up when it became clear that this was not going to be a 2-month problem, that this was ongoing. So that was really a unstable situation. One of the things that we found through the food distribution that we did was that we have really very limited storage and transportation capacity for food in the city, especially when we realized that we were going to be having to provide food in a socially distanced manner. So many of our plans and ways that we usually do these are congregate, where everybody comes together to get things. And being that wasn't possible, it really stretched our ability to be able to provide things in a safe way. We also really had a lot of limitations in terms of being able to equitably distribute things throughout the neighborhoods in the city, because there are not storage hubs. There's not a huge refrigerator. There's not, a place to keep dry goods, that sort of thing. So we realized that that really limited us a lot. There was also a transportation issue. We realized when people, children and families are quarantined at home, or in the case of elders who, did not feel safe going out to get food, how you get food to them was really a limiting factor. One of the things that we realized was a real opportunity in this that we would like to definitely build up is mutual support between businesses and institutions. A lot of folks were saying, what do you mean we don't have kitchens all over the city? Of course we have kitchens and refrigerators all over the city. There are restaurants everywhere. But in the midst of crisis, we certainly, restaurants, businesses falling apart, and everybody trying to, basically hold everything together and staff things. We didn't have a system to activate those kitchens. And a lot of folks have really said, can we somehow be partnering with restaurants and having them providing emergency meals? And we just didn't have a system set up to do that when it was needed. And likewise, what I referenced before about Brown and URI, their dining halls and dining services producing a lot of food. There's definitely an opportunity for a mutual support and partnership to figure out how to better interact with those. So through the course of those couple of months of distribution, we did develop a rather extensive list of recommendations. That hopefully will be able to guide us going forward. On the bigger term, bigger picture, long term, our office does engage on food policy issues on a broader basis. The different ways that we do that are through the city's program called Lots of Hope, where we identify city-owned properties that are appropriate for being turned over to agricultural use. Our office staffs the food disparities group of the African American Ambassadors Group, and that group is really looking at structural and policy solutions to disparities specifically faced by Black and African American community. We support and share the nutrition working group of the Providence Public School Department's Health and Wellness Committee. And so we worked really hard on setting up good policies around procurement of school meals and quality of school meals, and also around local, engaging local growers and local foods in school meals through the Farmer School Program. We also have a program that we've been doing for a number of years where we offer incentives to food insecure families or to agencies that serve those families to enable them to discover and better use the farmers markets. So those are sort of the two different levels that we work on in both the emergency that we recently went through and sort of policy level things. Lori, next slide, please. So what we found through all this and the challenges that we know that we're faced with is really issues of capacity to equitably address both the emergency needs and long-term food security. We know that the inequities that exist in our communities mean that when a crisis hits, you know, communities of color and other communities that are traditionally faced with inequities are that much more impacted by these. So we really are approaching this that we need a long-term food security plan for the city that emphasizes equity and makes sure that those communities have more resiliency and more stability overall, so that when crisis hits, they are not as inequitably impacted, but on the other hand, also make sure that we have an emergency plan in place for the next time this strikes. So we realize that we don't currently have, despite all of our lessons learned, we don't have a codified, improved plan of action to enact and for future emergencies. And I said we do not currently have a long-term food equity and security strategy to improve resilience to future emergencies. And as Lori referenced, also staff capacity is enormous. Like she said before, also it sounds like we're doing a lot. We are at this point a staff of 4. 3 of us are on substance use and behavioral health issues. So we do a lot with very thin people. And if we really want to address these issues more deeply, we really need to increase our capacity. And then challenge 2, which I mentioned earlier, we really need to increase the physical capacity for food storage and distribution throughout the neighborhoods. Next, please, Lori. So that really lays out what our priorities are going forward. Developing the food security infrastructure to store, distribute, and transport food. And both that would enable our neighborhoods to have better quality and better capacity for food programming and nutrition programming overall on the day-to-day, but that also can be pivoted and activated in case of emergency. And then the second piece of it is developing and implementing a Providence food security and emergency response plan that integrates the recommendations from our 2020 experience that prioritizes equity and resiliency. One of the things we want to make sure is that when we have a network of folks to turn to in times of emergency, that it is representative and can really reach into pockets of the community that we may not be in touch with on a day-to-day basis. And then, of course, identifying long-term funding opportunities for sustainability of this work is priority of that planning process. Next slide, please, Lori. And this talks a little bit about some partnerships and funding possibilities that we can engage with. In terms of food, there are opportunities through USDA, Department of Environmental Management, the Department of Health, partnership with the Rhode Island Food Policy Council, and of course, community partners are really paramount, but we really would need to identify what the specific opportunities that we would want to pursue through those are. Lori, did you want to speak to the other partnership funding sources there?
Sure, and we realized that we have the ability to connect with FEMA on a deeper level on disaster response efforts. We know that in crisis, FEMA is our go-to. And we also would love to increase the, as I mentioned, social determinants of health efforts that are on the ground. We realize working alongside community partners is a must in order to mitigate some of the issues that are on the ground, and identify and working closely with social service providers who can address these disparities in real time. As Rachel mentioned, our small staff was on the ground delivering food, but we know, more hands on deck is always better. So being able to share the responsibility across our social service providers and also community partners is ideal.
And I guess now is any questions that folks have?
Oh, answer it up. Good.
Okay, thank you.
Sorry.
Hi, Rachel, it's Paige. Thank you so much for your presentation. And first, I want to thank you and your whole team for the incredible amount of work you all did to get meals out to residents and families and children. I mean, and with an immediate response, I know that had to be like around the clock work, and the urgency you all put to making sure people had food matters. And thank you so much for all of that really hard work. My question for you is, if when looking at some national data and research, we see now that the pandemic EBT benefits, which was direct payments to families whose children missed meals in school, had a great impact on addressing food insecurities for families, as well as the child tax credit also has had a great impact, especially for food insecurity for families with children. And so I'm wondering if your department has also looked at similar programs that could provide direct funding and payment in cash to families for use of food, and maybe relying a little bit less on direct food distribution, but more to direct kind of a cash payment type of program. So I'm curious about your thoughts on that.
I would say so far the only way that we actively engage in that is through the farmers market incentive program that we have. So that's about, I think we have $10,000 in this current budget that goes out. Basically, it's essentially cash. It's, vouchers that people take to the farmers market that they can exchange for fresh produce. And that has been a pretty successful program. We've learned a lot about how to run it well, but that's the only way that we really engage at this point with any sort of direct payment model. I think that it makes a lot of sense. And I know that you are engaged with the guaranteed income work, which I think is a really important sort of model for how those things work overall. I think we haven't so far done much looking at other sort of cash food incentives that the city might offer. It would be really interesting to think about in sort of the ARPA context, if that would be a good use for those funds. I think knowing also that the ARPA is only a few years time frame, so we certainly wouldn't want to start something up that then after a couple years is throttled off. But I do think it's worth considering. I think that there are a lot of examples about how actual cash incentives really are much more helpful than a lot of other forms.
Yeah, I'll just add, actually, Paige, I know that, as mentioned, you're part of the guaranteed income work, and next week the council will be talking about other financial economic models that we can help support individuals and families through direct cash assistance. And what will be discussed next week, we'll go over some of the other pushes to the guaranteed income national work that's happening, to the national movement of mayors who are trying to push forward that guaranteed income floor that can address some of these things. So all these pieces like the child care tax credit and the extension of that, they've been advocating for at a federal level along all the mayors. Us being part of that, hoping to enact that change at the local level. So I know that HCO is really instrumental in pushing for waivers to allow a lot of flexibility around food distribution early on. And we are certainly interested in trying to figure out other ways to to help people in need and have that utility of choice and how to use the resources as well.
And one thing I'll add to that also is that, you know, a very interesting parallel overall is SNAP, right? And so that is shown to be been overwhelmingly just an amazing benefit to all, because what you're really doing is giving people dollars to spend on food, and that those dollars go to local businesses overwhelmingly, right? So, I mean, I think at this point, SNAP is more or less a cash benefit for, but you know, for food alone. And it would be an interesting thing to look at if it's better to advocate for expansion of SNAP and make sure as many people as possible are accessing SNAP, or if it would be efficient to create any kind of specific city incentive. So that would be worth considering.
Yeah, I remember you hear me.
Okay, I was really interested in your emergency network of restaurants, and a couple things on that. One is I would encourage you to look at places that have larger kitchens rather than restaurants, so like the convention center and all of the hotels that have banquet facilities, because a lot of restaurants don't have the infrastructure. Some of them don't even have refrigerators. The other, or walk-in refrigerators. So, and the other thing I would add, question I had was, does your plan call for the underwriting of staff and food costs for those facilities?
So far there is no plan. So I
Okay.
think the plan that we come up with definitely would have to take all of those things into consideration. Yeah.
Because I would say that would be a great way to keep some of those people employed.
Yeah, exactly. And I think that's what we found with the larger institutions like URI and Brown. Basically, they were like, we have, you know, their staff, their kitchen staff are unionized, and they were like, we have to keep them working. So what are they doing? You know, and what they did was produce a lot of foods for us, which was great. But I think that that is really good model, exactly for how you can use this sort of as an opportunity to, on the one hand, get food out to the community. On the other hand, make sure that local businesses and institutions and everything like that are supported through times of crisis, to sort of pivot those activities from your daily serving of meals to making sure that the funding is now coming in for crisis response. I think it would be a really great model.
Yeah, and then the other piece I would probably add to that is, if you are looking for the quickest way to build that network, you'd probably want to work either with the Rhode Island Hospitality Association or us, the Convention and Visitors Bureau, because we have the comprehensive databases on restaurants and hotels in the city, and
Great.
It's be really easy for us to help you with that.
Great, thank you.
No worries.
Hi, Lori and Rachel. I wanted to piggyback on the last two questions. First, I appreciate the data points that were shared and sort of the challenges that have been identified, and was wondering if, since the data that you shared from, I think it was March to June of 2020, where you had like the 1.4 million meals served, if you've seen any progress since you had identified the disconnect between the supply and the need, if you've seen any changes in trends or had any initial, even anecdotal updates on where things stand now. I know we were definitely in a different place a year ago, but obviously the need is still ongoing. So that's my first question.
So let's see. So at the end of last summer, in terms of the bulk of those meals having been provided through the Parks Department and through schools, as of the end of last summer, schools went back to serving meals more actively at the schools. I think they really struggled because with distance learning, you know, there are 24,000 kids in Providence Public Schools, and I believe it's something like 17,000 of them get lunch every day, and those numbers dropped dramatically with distance learning because folks were being asked to come pick up their kids' meals for the most part, and that just wasn't happening. And I think it might be it's possible that the PEBT benefit actually helped buffer that, so people didn't feel like they needed to go pick up those meals. So that's a strong possibility. But I just think also the whole distance framework made school meals just a very difficult thing to access for a lot of people. So in terms of a lot of the other meal sources and distribution routes we had, frankly, like I indicated, a lot of those dried up because the donations dried up. And so because nobody quite understood that we were going to be in this situation as long as we've been in, there was this sudden flood of hundreds and thousands of meals. And then, the philanthropy dried up, or the, folks ended up at Brown and URI, people ended up being back in the cafeteria. So there were, they weren't providing that same thing anymore. So we haven't really been able to track a lot of that other, that other patterns, I guess, since then. Does that answer the question?
It does. Yeah, I know that it's easier to look back when, further in the distance when the data and the activity was greater. So I appreciate that update. My second question kind of piggybacks more off of Paige's thoughts about direct cash assistance through PEBT and other resources, and was just, wanted to both ask and offer, United Way 211 as a resource that's been plugged into both PEBT enrollment and providing direct food distribution through the Quarantine and Isolation Resource Center in partnership with DHS and RIDO. And so, those are ongoing efforts that are certainly statewide, but can be called upon to through that touch point, connect with local community-based organizations that are well-positioned, like the Elisha Project and other organizations that are doing food distribution to folks who can't make it to a food access point. So just wanted to share 211 as a resource, and also ask if there, kind of what if any connection to date has been made.
So I do know that there's definitely a strong relationship between our 311 and the Mayor's Center for City Services and 211 in terms of anything 311 doesn't know, 211 knows. So I think that there's a lot of cross communication that happens there. But I definitely thank you for the suggestion and the offer to connect better. I think, when you mentioned the Elisha Project, I think one of the things that's been so interesting is that a lot of, we've been in such a strange time warp for the past year and whatever. So we have things like the Elisha Project and Cartwheel and other local organizations that came up in response to the pandemic. So at the start, a lot of those things didn't exist at all, period. So it's great that there are systems and organizations and everything that have developed in response. I guess I hope that they are able to sustain themselves and sort of shift as times shift and needs shift. So
thank you. And then if I can have one more question, I'm gonna channel Julian, because he usually asks this question. If you have a concrete ask or request that you would make of this task force to consider as we think about allocation recommendations to support the development of a plan or next steps with the challenges you've identified?
So I think there's some very concrete things around development of infrastructure, development of storage, distribution, refrigeration, transportation, that sort of stuff that is real. I don't have a dollar number on it, but with some work, a dollar number could be put to that, and there could definitely be a plan to make those changes in the next few years. And then the other piece, really, as I mentioned, is really about the development of that plan, so that we're not back in the same position, next time a crisis like this strikes. Those are to me, and I would say development of the plan and then implementation of some of the early recommendations from the plan would be what my early asks are.
I'm good.
Okay. Any further questions?
I have one question. The question is, what is the target market? I mean, what's the target for the survey? Like, how many surveys gathered to be able to make a collective decision amongst the committee. And then also, for sustainability, you guys are focused on two priorities. Food is so connected to our mental health. We're focusing on the behavioral side of mental health, I think a lot more than the actual connection that food has to depression and anxiety. And as we considered, like Philadelphia, they created a sugar tax that they were able to create $1 million worth of revenue in 2019. Has that been considered to be able to sustain the capacity to be able to hire these people? Like, it would create an infrastructure, and it would also start conditioning our folks not to be eating these fluctuating mood swing triggers like sugar, and so forth. So if we would be able to create some type of sugar tax that would help sustain an ability to be able to retain a community that is focused on mental health and well-being, we could actually get somewhere, and we could be able to purchase those things that are necessary to be able to sustain problems that we have with mental health and food disparities. So I think we should be looking at, ways to create infrastructure through taxing the bad eating habits that are triggering the mental illnesses that we have in our community. So, I don't know.
Did you hear all that, Lori and Rachel?
I heard some of it.
I did not.
The first question, okay, the first question was related to, just to let you know, was related to, do you have a specific number of surveys you'd like to gather in your research, if you've determined that? And number two was really looking at the connection between mental health and food, and whether or not the city has explored a sugar, sweet, and beverage tax to be able to help sustain some of the efforts of the office.
So
I can, go ahead, Rachel.
on the sugar sweetened beverage tax, I'll say that there was, before the state legislature in this past session, a sugar sweetened beverage tax proposed, and my understanding is that it didn't pass. Our office supported that, and the city supported that effort, and we supported it because we really believe in approaching things from a structural point of view, and that our responsibility is to set up the structures that create opportunities for good health in our community. And so our support of that was not because to be punitive of people who buy soda or other sugar sweetened beverages, but it was because that because the funding that was proposed through that was going to go to help expand people's access to fresh fruits and vegetables. So, so I'll say in general, that was our approach to that, is that we should be creating new opportunities and not using things like that to punish or disincentivize people. But it didn't pass. And I think, any other specific taxes that the city would levy would really have to be through a legislative process. That I believe we don't actually have the authority to levy taxes without going through a rather complicated process with the state. That's my understanding of that. Lori, did you have other?
Yes, I wanted to touch on the research question around what an ideal number would be. We do not have an ideal number, but we definitely would want a significant amount of community members involved by way of survey and or focus groups and or community meetings, any way possible to hear how folks are doing at this time, right? Looking at disparities across social determinants of health, including where folks are financially, how are they doing, in the new education space that we are, looking at healthcare access, have folks increased their healthcare access, or has it, they need support in that, looking at their neighborhood and home environment, asthma, lead, looking at all encompassing things that could essentially put folks at a deficit in the next disaster, is what we would like to do, but do not have capacity to do. So in terms of research, that would be ideal, but we do not have a specific number we're looking towards, just more significance in being able to touch various neighborhoods, folks of different language, folks of different citizenship status, all of the above, in order to help frame what the Healthy Communities Office does next. And I hope that answers the question.
If there are no further questions, we can adjourn our meeting.
Do you want to open any public comment? I know we're late.
Oh, yes. Number 4 is public comment. Item number 4 on the agenda is public comment. Do you have any comments from in the room or virtually?
If you'd like to make a comment on the webinar, please use the raise your hand feature so that we can unmute you. Okay.
If there are no further comments, we will adjourn the meeting. Thank you for attending. Look forward to seeing you next week. Thank you, Rachel and Lori, for your presentation.
Thank you all.
Thank you.
Take care.
Thank you.